5 days ago, something happened that will affect more Americans than any headline you have seen this year. At midnight on December 31st, 2025, while most of the country was counting down to the new year, enhanced health insurance subsidies for more than 20 million Americans quietly expired. No fireworks, no press conference, just a policy change that will double health insurance costs for millions of families starting this month. A single mother in Colorado woke up on January 1st to discover her monthly premium had jumped from $85 to nearly $750. A chiropractor in New Jersey learned his family plan would cost $1,128 a month, up from $340. A freelance musician in New York City who paid $0 for his premium last year now faces a $275 monthly bill he simply cannot afford. These are not outliers. These are the new normal. And the question everyone is now asking is simple. How did we get here? And what happens next? Here's what you need to understand. The Affordable Care Act, often called Obamacare, has been law since 2010, but the subsidies that just expired were not part of the original legislation. They were emergency measures passed during the COVID-19 pandemic in 2021 under the American Rescue Plan. These enhanced premium tax credits did two critical things. First, they increased the amount of financial help people received. Second, they eliminated what policy experts called the subsidy cliff, a sharp cutoff that previously denied any assistance to households earning just over 400% of the federal poverty level. Let me explain why that cliff mattered so much. Under the original ACA rules, if you earned 399% of the federal poverty level, you got help paying for insurance. If you earned 401%, you got nothing. That single percentage point could mean thousands of dollars in difference. A small raise at work could actually leave you worse off because you lost your subsidy. The enhanced credits eliminated that cliff entirely. Anyone could qualify for assistance if their premium exceeded 8.5% of their income. That change brought coverage within reach for millions of middle-income families who had been priced out before. The Inflation Reduction Act in 2022 extended these enhanced subsidies through the end of 2025. Everyone in Washington knew this deadline was coming. It was not a surprise. It was not an emergency that appeared out of nowhere. Policy experts, insurance commissioners, and healthcare advocates spent months warning about the consequences of letting these subsidies expire. And yet, here we are. The result was dramatic. Enrollment more than doubled. Record numbers of Americans signed up for coverage through the marketplace exchanges. In 2025, total enrollment reached 24.3 million people, the highest in the program's history. 4 out of 5 people on the exchanges could find a plan for $10 or less per month. The growth happened everywhere, but it was especially concentrated in states you might not expect. Texas saw enrollment grow by 255% since 2020. Mississippi grew by 242%. West Virginia by 234%. Louisiana by 234%. Georgia by 227%. Tennessee by 221%. These are not traditionally blue states. These are places where the uninsured rate was high, where Medicaid expansion never happened, where working families had few options for affordable coverage. The ACA marketplace became their lifeline. Florida alone has more than 4.7 million enrollees, the largest of any state. That is more than the entire population of many states. Texas has nearly 3.9 million. These are not small numbers. These are not fringe populations. These are mainstream Americans who work, pay taxes, raise families, and need health insurance like everyone else. Now that math has completely changed. According to analysis by KFF, a nonpartisan health policy research group, annual premium payments for subsidized enrollees will more than double, rising by 114% on average. That translates to roughly $1,016 more per year for the typical enrollee. But averages can be misleading. Many people are seeing their costs triple or even quadruple overnight. The people hardest hit fall into specific categories. Small business owners who cannot afford to offer employer coverage, self-employed workers and freelancers, farmers and ranchers in rural America, gig economy workers without access to traditional benefits, early retirees who are too young for Medicare but too old for affordable individual market rates, and anyone with a chronic condition who absolutely cannot go without coverage. There is a common misconception that ACA marketplace plans are for the unemployed or the very poor. That is not accurate. Medicaid covers the poorest Americans. Medicare covers seniors. The marketplace serves people in between. People who work but whose employers do not offer insurance. People who own their own businesses. People between jobs. People who are self-employed in industries where employer coverage simply does not exist. Think about who that includes. Musicians, artists, writers, real estate agents, consultants, contractors, chiropractors, dentists, farmers, Uber drivers, Etsy sellers, small restaurant owners, local shop owners, massage therapists, personal trainers, photographers, web designers, the entire creative economy, the entire gig economy, the entire small business economy. Nearly half of all adults under 65 enrolled in marketplace plans are connected to small businesses. Either they own one, work for one, or are self-employed. These are not people gaming the system. These are Americans caught in a coverage gap that employer-based insurance does not reach. Consider Eric and Lisa Frankenfeld from Point Pleasant, New Jersey. Eric is a chiropractor. Lisa manages their practice. They are healthcare providers by profession. Yet starting this month, they will be uninsured. Their premium jumped from $340 to nearly $1,128. They cannot afford it. Lisa lies awake at night worrying about what happens if one of them gets diagnosed with cancer or suffers a heart attack. They have made the impossible choice to go without coverage. Or take Stan Clausen, a 49-year-old freelance filmmaker and adjunct professor in Salt Lake City. He lives with paralysis from a spinal cord injury. Health insurance is not optional for him. It is survival. His premium jumped from just under $350 a month to nearly $500. He is absorbing the cost because he has no other choice. But for many others, there is no money left to absorb. Caitlin Provost is a 37-year-old single mother and social worker. Her monthly premium went from $85 to nearly $750. She is holding out hope that Congress will act in January. If they do not, she will drop her own coverage and keep insurance only for her 4-year-old daughter. She cannot afford both. The geographic impact is also uneven. Florida has the largest number of ACA enrollees of any state, more than 4.7 million people. Texas follows with nearly 3.9 million. Georgia, North Carolina, and California round out the top 5. Ironically, 88% of marketplace enrollment growth since 2020 has come from states that President Trump won in the 2024 election. These are not coastal elite enclaves. These are working families in red and purple states who found affordable coverage through the exchanges. Here's the part that makes this story even more complicated. Congress had every opportunity to prevent this outcome. Democrats tried. They triggered a 43-day government shutdown, the longest in American history, specifically over this issue. They made extending the subsidies their central demand. Federal workers were furloughed, air travel was disrupted, food assistance programs were delayed, government services ground to a halt. All because Democrats refused to fund the government without a commitment on health care subsidies. In the end, they settled for a promise. Senate Republicans agreed to hold a vote on the subsidies in December, but a promise to vote is not the same as a promise to pass. Democrats took a gamble. They bet that when the moment came, enough Republicans would cross party lines to save coverage for millions of their constituents. They bet wrong. When December arrived, 2 competing bills came to the Senate floor. Democrats proposed a clean 3-year extension of the enhanced subsidies. Republicans countered with an alternative that would convert subsidy money into health savings accounts. Both bills failed to reach the 60 votes needed to advance. The Democratic plan got 51 votes in favor, but 4 Republicans crossed party lines to support it. Susan Collins of Maine, Lisa Murkowski of Alaska, Dan Sullivan of Alaska, and Josh Hawley of Missouri. It was not enough. In the House, Speaker Mike Johnson refused to bring any subsidy extension to the floor. He pushed instead for a separate health care bill that addressed pharmacy benefit managers and association health plans, but did nothing about expiring subsidies. The bill included funding for cost-sharing reduction payments starting in 2027, which Republicans said would help lower deductibles, but it offered nothing for the millions facing premium spikes right now. Moderate Republicans were furious. They had been trying for weeks to find a compromise. They proposed amendments. They held meetings. They made the political case to leadership that letting subsidies expire would cost them seats in 2026. Johnson was unmoved. At a closed-door conference meeting, tensions boiled over. Members described the situation as idiotic and political malpractice. 4 of them, Brian Fitzpatrick, Rob Bresnahan, and Ryan McKenzie from Pennsylvania, plus Mike Lawler from New York, broke with their leadership. They signed a Democratic discharge petition that forces a House vote on the 3-year subsidy extension. The petition reached 218 signatures, the minimum threshold needed. That means a House vote will happen in January when Congress returns. But there is a catch. Even if the bill passes the House, it faces serious obstacles in the Senate. Republicans have already rejected this exact proposal once, and President Trump, who briefly floated support for some kind of solution, backed off after conservative backlash. Meanwhile, the clock has run out. January 1st has come and gone. The subsidies are expired. Premiums have already spiked. spiked, people are already making decisions about whether to keep coverage or drop it. The enrollment deadline for plans starting January 1st was December 15th. For those who missed that window, coverage starting February 1st requires enrollment by January 15th. What makes this particularly painful is the political math. Polls consistently show overwhelming support for extending the subsidies across party lines. A survey by Republican pollster John McLaughlin, who has worked with Trump on multiple campaigns, found that voters in competitive congressional districts are more likely to support candidates who back healthcare tax credits. The issue cuts across ideology. And here is the uncomfortable truth that no one in Washington wants to say out loud. Many of the people losing subsidies are voters in districts that will decide control of the House in 2026. The 4 Republicans who signed the discharge petition represent exactly those kinds of swing districts. They are not acting out of idealism. They are acting out of survival. Mike Lawler called ignoring this issue political malpractice. He was not wrong. So what happens now? There are 3 scenarios playing out simultaneously. Each one leads to a very different future. Scenario 1 is the best case. Congress acts quickly in January. The House passes the 3-year extension. Pressure mounts on the Senate. A bipartisan group of senators, including Susan Collins, has been meeting to craft a compromise. Perhaps they find middle ground. Maybe the extension comes with modifications like income caps that limit eligibility to households below a certain threshold, or new enrollment restrictions to address Republican concerns about fraud, or requirements that everyone pay at least some minimum premium rather than getting coverage for free. If a compromise emerges and both chambers pass it, the subsidies get restored. State exchanges reopen enrollment. Insurers recalculate premiums. People who dropped coverage can come back. The immediate crisis passes. This scenario is possible but not probable. The same divisions that prevented action in December still exist in January. Scenario 2 is the base case. Congress remains gridlocked. The House passes a bill that dies in the Senate. Bipartisan talks drag on without resolution. Premiums stay high throughout 2026. Millions of people drop coverage. The issue becomes a central fight in the midterm elections. Democrats campaign on Republican inaction. Republicans campaign on ending pandemic-era spending. Neither side blinks until after November. This scenario is the most likely. Scenario 3 is the worst case. Congressional paralysis becomes permanent. No extension passes in any form. The individual insurance market begins to destabilize. Healthier, younger enrollees drop coverage because they cannot afford it. The remaining pool becomes older and sicker. Insurers raise rates even further to compensate. A death spiral begins. What does a death spiral look like in practice? It starts slowly. Premiums go up. The healthiest people drop out because they can take the risk. That leaves a sicker pool. So premiums go up again. More people drop out. The pool gets sicker. Premiums rise further. Eventually, the market becomes unsustainable. Insurers exit. Choices disappear. What remains is expensive, inadequate, and available only to those who absolutely cannot live without it. We have seen versions of this before the ACA existed. The individual insurance market in many states was essentially broken. Premiums were astronomical. Pre-existing conditions meant denial of coverage. Millions of Americans simply had no options. The ACA fixed that. The enhanced subsidies accelerated the fix. Without them, we risk sliding backward. Hospitals would see rising uncompensated care. When uninsured people get sick, they still need treatment. They go to emergency rooms. They cannot pay. Hospitals absorb the cost or pursue debt collection. Neither option is good. Rural facilities that already operate on thin margins face closure. Communities lose access to care. The coverage gains of the past 4 years unravel completely. Each scenario has real consequences for real people. According to projections from the Urban Institute and Commonwealth Fund, roughly 4.8 million Americans could drop coverage in 2026 due to the premium increases. The Congressional Budget Office estimates that without the enhanced subsidies, about 4 million people will become uninsured in the coming years. Some states are trying to fill the gap on their own. New Mexico is the only state fully replacing the expired federal subsidies for 2026 with $17 million in state funds. California allocated $190 million to cover its lowest income enrollees, but that replaces only a fraction of the $2.5 billion in federal subsidies Californians received in 2025. Maryland is covering people below 200% of the federal poverty level and providing partial help for those between 200 and 400%. Colorado committed $100 million. Connecticut pledged $70 million. These state efforts are admirable but insufficient. They cannot replace the scale of federal support, and they create a patchwork system where your access to affordable coverage depends entirely on where you happen to live. There is another layer to this story that deserves attention. The politics of the Affordable Care Act have shifted dramatically since its passage in 2010. Republicans spent years trying to repeal it. They came within one vote in 2017. John McCain's famous thumbs down saved the law. But since then, something changed. The ACA became entrenched. Enrollment grew. People started depending on it. Repeal became politically toxic. The turning point came when Republicans realized that millions of their own voters were on the exchanges. Look at where enrollment grew the most. Texas, Florida, Georgia, Mississippi, Tennessee. These are not Democratic strongholds. These are states Trump won decisively. The people using the ACA marketplace are not the people Republicans imagine when they talk about government dependency. They are farmers, small business owners, self-employed professionals, the exact demographic that forms the Republican base. Now, Republicans find themselves in an awkward position. They control both chambers of Congress. They could extend the subsidies tomorrow if they wanted to, but their base views the ACA as big government overreach. Conservative media has spent 15 years calling it socialized medicine. Many rank and file members still want to see it fail. Tea Party ideology runs deep in the Republican conference, so they are caught between their ideology and their constituents. The result is paralysis dressed up as principle. Senator Bill Cassidy of Louisiana, a physician who helped craft the failed Republican alternative, represents this tension perfectly. He knows the subsidies help his constituents. He also knows his party hates the program. His solution was to convert subsidies into health savings accounts, a proposal that lets Republicans claim they did something without actually preserving the same level of support. Democrats rejected it instantly. Democrats are not blameless either. They spent years extending the subsidies on a temporary basis rather than making them permanent. That created artificial cliff dates that became political leverage points. Every time the deadline approached, it became another fight, another negotiation, another chance for things to go wrong. When Democrats controlled Congress and the White House in 2021 and 2022, they could have made the enhanced subsidies permanent. They chose not to. The Inflation Reduction Act extended them only through 2025. The reason was budget math, making subsidies permanent costs more on paper than extending them temporarily. Democrats wanted to keep the official price tag of their legislation lower. They gambled that Republicans would never let millions of people lose coverage on their watch. That gamble failed, and now millions of Americans are paying the price for Washington's inability to solve problems permanently. What does this mean for you specifically? If you are currently enrolled in an ACA marketplace plan, check your 2026 premium carefully. Do not assume it stayed the same. Log into your state exchange or healthcare.gov and look at your actual costs. Many people have been auto-renewed into plans that now cost dramatically more than what they were paying. Open enrollment runs through January 15th in most states. Some states like California, New York, New Jersey, and Rhode Island have extended their deadlines to January 31st. You still have time to compare plans, though your options may be more expensive than before. If you cannot afford your current plan, consider switching to a bronze level plan with lower premiums but higher deductibles. Bronze plans typically have deductibles around $7,500, which means you pay that amount out of pocket before most coverage kicks in, but the monthly premiums are lower. If you are generally healthy and do not expect major medical expenses, a bronze plan might make financial sense. Or look at catastrophic plans, which are now available to people losing subsidies regardless of age. Previously, these plans were limited to people under 30. Now, anyone losing enhanced subsidies can qualify. Catastrophic plans have very high deductibles, up to $10,600 for an individual in 2026. But they protect you from worst-case scenarios like cancer, serious accidents, or major surgery. Think of them as financial disaster insurance rather than coverage for routine care. If you are considering dropping coverage entirely, understand the risks. Medical debt is the leading cause of bankruptcy in America. One emergency room visit, one unexpected diagnosis, one serious accident can create financial devastation that takes years to recover from. Going uninsured is not free. It is a gamble where the stakes are your financial future. Pay attention to what Congress does in January. The House returns on January 5th. The Senate is already back in session. If you want your voice heard, contact your representatives, particularly if you live in a swing district with a vulnerable member. Politicians respond to constituent pressure. That is the entire reason 4 Republicans broke with their leadership to sign the discharge petition. They heard from their voters. They knew the political cost of inaction, and they acted. Phone calls matter, emails matter, town halls matter, social media posts matter. The reason healthcare remains politically potent is that it affects everyone. Every voter has a personal stake. Use that leverage. Watch for news about special enrollment periods. If Congress does restore subsidies later this year, exchanges will likely reopen enrollment. You may get another chance to sign up or switch plans. Keep your options open. Finally, do not panic, but do not ignore this either. Healthcare costs in America are brutally high. Insurance is expensive, but the alternative, being uninsured when something goes wrong, is usually worse. Here is where we stand as of today. The enhanced subsidies that help 22 million Americans afford health insurance have expired. Premiums have more than doubled for most marketplace enrollees. Millions of people are facing impossible choices between coverage and other necessities. Congress failed to act before the deadline, despite months of warning. A House vote is coming in January, but its fate in the Senate is uncertain. State-level efforts to fill the gap are helpful but limited. And the 2026 midterm elections will almost certainly be shaped by how this plays out. The Affordable Care Act has survived legal challenges, repeal attempts, and administrative sabotage. It has become a fixture of American life for millions who have no other option. But surviving is not the same as thriving, and right now, the system is under severe stress. Whether you see this as government overreach finally being corrected or essential support being ripped away depends on your politics. What does not depend on politics is the math. 22 million people just saw their insurance costs spike dramatically. Some will absorb it, many cannot, and the consequences will ripple through families, communities, hospitals, and ultimately elections. The subsidy expiration is not an abstract policy debate. It is a practical crisis affecting real people making real decisions right now. A single mother choosing between insuring herself and her daughter. A small business owner becoming uninsured for the first time in decades. A freelancer rationing care because coverage is suddenly unaffordable. A cancer survivor wondering how she will pay for follow-up screenings. These stories are playing out in every state, in every congressional district, in communities across the country, and they will continue playing out for months until Washington decides what to do next, if Washington decides at all. So here is the question I want you to think about. What should happen next? Should Congress restore these subsidies? Should they let the expiration stand? Should states step in? Should individuals bear more responsibility for their own coverage? There are no easy answers, but there are real consequences, and those consequences started 5 days ago. This is not just a policy debate, it is a values question. What do we owe each other as a society? Is healthcare a right or a privilege? Should the government help people afford coverage, or should the market decide who gets insured? These questions have animated American politics for generations. The ACA was one answer. The subsidy expiration is another. Whatever your politics, the human reality remains the same. Millions of Americans are facing genuine hardship right now. They did nothing wrong. They played by the rules. They signed up for coverage. They paid their premiums. And now the rules have changed, and they are caught in the crossfire of a political fight they did not start. Drop your thoughts in the comments. I want to hear from people directly affected by this. How has your premium changed? What choices are you facing? And what do you think Congress should do? Subscribe if you want to stay informed on how this develops. The January vote could change everything, or it could change nothing. Either way, you need to know what is happening, because this story is not over. It is just beginning.